Hi everyone, my name is Lydia Manka and I am pleased to present to you the findings of my pilot program. The program addresses the intersection of HIV prevention and mental health care in African American populations. The presentation will cover the health issues, program objectives, implementation strategies, and evaluation findings. Our goal is to highlight the impact of culturally tailored interventions. I look forward to discussing the outcomes and how they will shape future implementations. Here are some key health issues and rationale for our program implementation. HIV disproportionately affects African American communities. The stigma around HIV and mental health leads to delayed diagnosis and poor treatment adherence. Mental health issues like depression and anxiety are common among individuals living with HIV. Addressing both HIV and mental health together improves health outcomes. The rationale for this program is to reduce stigma and improve access to care through integrated services. Here's a look at our target population and our project setting. Our target population is African American individuals at risk for or living with HIV. These populations face higher HIV infection rates due to barriers like stigma and lack of healthcare access. High rates of co-occurring mental health conditions such as anxiety and depression complicate HIV care. Reliant Family Psychiatry, known for its work with underserved populations, is our stakeholder. The program was designed to meet the need for culturally competent HIV care integrated with mental health services. Here's a look at our program goals and objectives. Our program goals include reduce stigma associated with HIV and mental health, and to promote HIV testing for improved treatment adherence. And our objectives include increase participation in health education sessions by 30%, improve understanding of HIV-related mental health issues by 50%, and enhance community engagement through social media by 35%. Let's take a look at our project implementation and strategies. The goal is to promote health education, which is achieved by conducting workshops in community centers to reduce stigma and promote mental health awareness. Use social media campaigns to increase awareness of HIV and its mental health implications. Post educational materials in high traffic locations to increase community awareness. Collaborate with community health workers to recruit participants and distribute materials. And distribute flyers and make announcements in local churches and clinics to raise awareness about the program. Here is a look at our program logic model. For our input, we have partnerships with Reliant Family Psychiatry, community health workers, funding from our local government and community trust. For our activities, we have outreach workshops, social media campaigns, and posting of educational flyers and posters in locations around the community. For our output, we have increased participation in workshops, social media engagement, and distribution of materials. Our short-term outcomes include increased awareness, reduced stigma, and improved mental health awareness. Our long-term outcomes include increased HIV testing, and overall treatment adherence. And here's a look at our project partners and collaborators. We have Reliant Family Psychiatry, which is a trusted community health provider with expertise in mental health. We have community health workers who are essential in recruiting and engaging participants. We have our local churches and clinics who are critical in hosting workshops and distributing materials. And we have funding and resources secured through local health agencies to support our program activities. In order to evaluate our project, the measures taken included surveys, social media analytics, and participant feedback. We collected pre- and post-workshop surveys to assess knowledge and attitude changes. We used engagement metrics to track our social media reach and interactions. Feedback was collected from workshop participants to assess the program's impact. And we measured indicators of success like increased attendance, improved knowledge, and engagement. Our program needs constituted of staffing resources like community health workers, program facilitators, and coordinators. We allocated $1,000 for materials, $300 for digital campaigns, and $250 for refreshments. This went towards printed materials, social media promotion, and workshop supplies. The workshop was funded by local health organizations and government agencies, and we will need additional funding for program scalability and outreach expansion. Here is a brief program overview. Our pilot program implementation, which focused on health education workshops, social media campaigns, and mindset change, was successfully implemented. We had 50 participants who attended the workshop, and over 500 people were reached through social media. The outcome of our program was increased awareness and engagement in mental health and HIV care. We received positive feedback from participants and increased interest in follow-up sessions. For our evaluation procedure, surveys, social media analytics, and participant feedback were used to assess program success. We also used pre- and post-assessments for workshops and engagement metrics from social media. For our evaluation findings, we had 70% improved understanding of HIV-related mental health, 35% engagement rate, which exceeded our expectations, and 20% of viewers sought more information. Here is the implication of our evaluation. Positive evaluation results validate the program's effectiveness and readiness for scaling, and increased awareness suggests the program's ability to reduce stigma. For our program fit, program feasibility was achieved with our existing resources. We addressed specific community needs for HIV care and mental health, and we received positive feedback from participants, which confirmed the program's cultural fit. For our program modifications, we will adjust our objectives to expand recruitment to younger demographics. We will increase digital outreach and plan virtual workshops to address issues like transportation barriers. In conclusion, the pilot program was successful The pilot program successfully increased awareness of HIV-related mental health issues by 70%. Social media campaigns exceeded engagement. Social media campaigns exceeded engagement targets, achieving a 35% interaction rate. Community outreach through posters and workshops effectively addressed stigma, with 20% of participants seeking additional resources. Participant feedback indicated high levels of satisfaction and a strong interest in follow-up sessions. This brings us to the end of my presentation. If you have any questions, here is my contact information on the screen. You can reach me at any time with questions. Thank you for watching my presentation. I appreciate your time and support for this important initiative. Your engagement helps us continue making positive impact in addressing HIV and mental health challenges. I look forward to seeing you all in our next workshop. Thank you.